Does your baby arch his or her back? Head and neck. Does your baby arch his back when you hold him in your arms or when you lay him in the crib? What does it mean if your infant arches his or her back? Maybe your baby also has digestive difficulties and you think it's gastroesophageal reflux? In fact, have you been told that if your newborn is arching, it is because he or she is suffering from reflux? Well, in this video, I explain the real causes why your newborn arches his back and what to do to resolve this issue and possible gastroesophageal reflux. Spoiler, back arching is not caused by gastroesophageal reflux. However, arching can coexist with the presence of gastrointestinal disorders of the infant and be worsened by reflux. I will explain everything in depth in a few minutes, but before I get into the heart of the topic, let me introduce myself. My name is Dr-Silva. I am a neonatal osteopath and founder of Yule, a maternal infant center in the province of Monza Brianza, in which I collaborate closely with all the main health figures in the field, such as pediatricians and midwives, visiting only newborns from their first days of life. You can find me on this YouTube channel, which I recommend you subscribe to now to stay updated on all new videos, on Instagram under the name Osteopath Silva Matteo. And especially on my website matteosilvaosteopata.com, where you will find hundreds of content and video courses to encourage the best motor and postural development of your baby, from birth to independent walking, but not only. You will find video courses to treat colic and reflux and video courses to encourage better language and relational cognitive development created by myself, pediatrician, speech therapist, neuropsychologist, and many other medical professionals in the field. Our mission is your health and your baby's health. That's why our goal is to show parents how to foster the best development of mother and baby from pregnancy through the early years of life. Now let's cut to the chase and get to the heart of this video. Why does the newborn arch his or her back and head? But more importantly, how to solve these issues, especially if they are related to gastrointestinal disorders. To understand the real causes why the newborn arches his or her back and head, it is necessary to start with a very brief outline of anatomy. In order to arch the head and carry it backward and arch the back, we need to activate the posterior muscles of the neck and the back itself. We are talking about the cervical musculature and the dorsal paravertebral musculature. The same musculature that we adults would activate if we lay on our stomachs and try to lift our heads and backs from that position. Here, once we understand the anatomy of the muscles responsible for arching, or rather extending the head and back, let us try to understand why the infant activates them. The explanation is simple and scientific. Due to intrauterine malpositions in which the newborn was left with an extended head or uncomfortable in the mother's belly, or because of a more or less difficult delivery in which the baby got stuck in the birth canal. Delivery struggled to come out and perhaps La ventosa was used. The baby may develop muscle contractures and joint stiffness at the cervical and orsal region. These contractures after birth may give the baby more or less discomfort, both when awake and asleep, and force him to arch his head and back backward. When the infant arches his or her back and head, he or she may have a preferred side, i.e., mainly rotate his or her whole body to one side or rotate his or her head to one side only. In these cases, we will speak of myogenic torticollis. In any case, it is very important to resolve these contractures and stiffnesses, both because they can negatively affect your baby's postural development, and also because if the infant maintains incorrect positioning of the little head in the first months of life, a period when the head grows rapidly but is extremely moldable, the skull may flatten and deform. This could create positional plagiocephaly, or another type of flat head. If you don't know what I'm talking about and want to learn more about this topic, you can find dozens of videos on my YouTube channel or on my website matteosilvaosteopata.com. Now, before I explain how to resolve these muscle contractures, I want to talk to you about the correlation between back arching and gastrointestinal disorders in the newborn, mainly gastroesophageal reflux, but also gas colic, bowing and reflux. Very often, infants who arch their backs are more irritable and annoyed. They often cry and suffer from gastrointestinal disorders such as colic reflux. Many parents are just told that their baby is arching because of gastroesophageal reflux. But is this the truth? The short answer is no. The long and dissociative answer I am about to give you. First of all, you should know that gas colic and gastroesophageal reflux of the newborn are not normal physiological, but are caused by an irritative and inflammatory state of the infant's gastrointestinal tract. I have also discussed this in depth here in other videos on the YouTube channel, in which I have also listed all the scientific articles that prove this, and I also link them to you in description. The causes of reflux colic, that is, the irritative and inflammatory state of the gastrointestinal system, are to be found in maternal nutrition in pregnancy and postpartum if breastfeeding, in gastrointestinal smooth muscle tensions, the type of bottle feeding and how the baby's milk is offered if artificially breastfed, maternal multivitamins, the baby's supplements, and much more. This is also why I highly recommend that you visit my website to find out how to effectively prevent or resolve these issues. I have created a special video course in which I explain exactly how to make your baby well in an easy and effective. Anyway, to answer the question, does the infant arch due to reflux? Let's remember that arching in the back is caused by activation of the muscles and contractures in the back itself. This misbehavior can be worsened and amplified by the fact that the child suffers from gastrointestinal disorders that lead him to accentuate a postural posture he already has. The proof of what I am saying is the fact that numerous children who arch sharply with their head and back do not suffer from reflux or even colic at all. On the contrary, they may even sleep peacefully all night long, albeit in a very arched position and perhaps even on their side. In these cases, muscle contractures are present in the absence of gastrointestinal complaints. Another proof that it is not reflux itself that causes back arching is the fact that thousands of children who suffer from reflux or even colic do not arch their backs at all. They simply cry, have a tummy ache or stomach ache, but do not throw back their head or back. So, in conclusion, the infant does not arch his back because of reflux, but in the presence of back contractures, reflux manifests them more prominently. Let us now move on to explain how the newborn's back contractures are resolved. I want to tell you right away not to worry. Contractures can be resolved easily, and in association with all the care to treat colic and reflux, your baby can finally be well and develop to the fullest. How does this apply to every muscle in the body? To decontract it, that is, to resolve contractures, you have to massage it. In my practice, I treat thousands of infants every year, and now I will show you some of the treatments I do to resolve neck and back contractures. Osteopathic treatments are gentle, pleasant, but most of all effective. They act on the lumbar, back, and cervical muscles, relaxing the muscles and restoring proper joint mobility. Depending on where the contractures are present, we will focus more on the cervical region, the dorsal region, or the lumbar region. Also, in the presence of gastrointestinal disorders such as colic, constipation, reflux, dyschezia, regurgitation, and so on, after giving all the fundamental cautions that I summarized in the course Cure and Prevention of Colic and Reflux that you can find on my website, I go on to treat the diaphragm and the gastrointestinal system. In this way, you get effective results within 2, 3, 4 sessions. You can find hundreds of reviews on my Google profile and dozens of parent testimonial videos on my YouTube channel. With these words, we have come to the end of this informative video, and let me tell you that it has been a real pleasure to create this informative content for you and your baby. If you enjoyed the video, I ask you to leave a like to this video. It costs you nothing, but it is worth so much to me, and subscribe to my YouTube channel. See you in the next video on my Instagram page, Osteopath Silva Matteo, and on my website, matteosilvaosteopata.com, where you can find dozens of insights and video courses recorded by me, but by the pediatrician, midwife, sleep consultant, and psychologist for Christmas that show you how to foster the best development of your baby from birth through the first year of life. See you soon.